Quick disclaimer before we begin, the PEMF podcast does not contain any medical advice, and the content provided is for informational purposes only. If you have any health concerns, please visit a healthcare professional. Welcome back to another episode of the PEMF podcast.
And today we're going to be talking about the painful yet common plantar fasciitis. We're going to be talking about how PEMF can help with this, some studies, and much, much more. But for anyone who this might be their first episode, what actually is PEMF?
So PEMF is all about treating the body at a cellular level. It stands for Pulse Electromagnetic Field Therapy, and it's applied usually with a full body mat or a localized applicator. And as I say, it's treating the body on a cellular level, creating the perfect environment within the cells and within the body to heal or perform better.
Okay, so how then can PEMF help alleviate some of these symptoms for someone with plantar fasciitis?
So yeah, we've mentioned it a number of times on this podcast, but reducing inflammation is such an amazing outcome of PEMF therapy. And so if you can decrease the inflammation in the area of the plantar fascia, that can provide additional relief from the pain and the swelling within the area. Promoting blood flow is also something we mention quite a lot. So we're talking about the cells in the body that also kind of stack up. That's one of the things you can see under a microscope of PEMF therapy. And if you apply PEMF therapy, within about 10 minutes, these cells start to separate and travel around the body a lot more effectively. So if you can improve the circulation to the area, you can bring more oxygen, nutrients to that area, and that's going to aid in faster healing naturally. So one of the other things is stimulating cellular repair. So PEMF can also enhance the cellular metabolism. So that's going to promote the repair of the damaged tissues in the plantar fascia, but also pain relief. So pain relief in terms of PEMF therapy can either be a byproduct. So we're talking about you're fixing the area that is causing the pain. So obviously that's going to reduce pain over time, but you can also get a pain blocking effect more commonly with high intensity PEMF. And that's all about kind of blocking the pain immediately. So many patients also report kind of reduction in pain levels following just one PEMF treatment. But as I say, multiple PEMF treatments can actually help heal the area, which is going to reduce the pain over time.
No, definitely. And if you want to see a actual like real life example of what Andy was saying about where the blood cells stack and after a 10-minute session, they unstack, one of our most recent posts on our Instagram shows you exactly that and shows you the real life example, as I say, under a dark field microscope and exactly how that kind of happens. But for this kind of PEMF and plantar fasciitis, is there any research? Is there any studies into this and it reducing it using PEMF?
Yeah, so there are multiple studies of PEMF therapy which have proved to reduce inflammation, increase blood flow, stimulate cell repair, helps relieve pain. So, you know, all those studies on their own can kind of show that this PEMF therapy would help with plantar fasciitis because they're all symptoms. But we did actually find two specific studies with PEMF and plantar fasciitis. One where the adult patients experienced heel pain from plantar fasciitis for over 2 weeks. They were treated with PEMF therapy and heat for 2 hours daily over 12 weeks, and they were assessed through an ultrasound examination and surveys at the baseline. These were at 4 weeks, 8 weeks, and 12 weeks. The ultrasound measured the thickness of the plantar fascia and the width of the hypochoric region. So while these different functional assessments were done, the two functional assessments, by the way, were the Foot and the Ankle Disability Index, so that's the FADI, and the Patient Specific Functional Scale, which is a PSFS.
And what were the results of the study? The
results from this study showed that the plantar fascia thickness reduced from 6.5 millimeters to 4.3 millimeters, which was a 34% decrease. The width of the hypochoric region decreased from 32 millimeters to 6.6 millimeters, which is a 79% decrease. The FADI scores increased from 55 to 81, which is a 46% improvement. And the PSFS scores rose from 2.9 to 7.7. So that was a 166% increase. So basically, all of this was an improvement in each section.
There was also another study that we found for PEMF and plantar fasciitis. These will both be linked underneath the episode, wherever you're listening. And what did that one show as well? Was that any different?
Yeah, so the second study used PEMF devices, however, with radio frequency. So pulsed radio frequency electromagnetic field, PRFE. So it's similar modality, but using PEMFs, but in a different way. And this device is treating plantar fasciitis. It was conducted as a double-blind, multi-center, randomized, placebo-controlled trial. And the study enrolled 70 participants diagnosed with plantar fasciitis. The participants of this one were randomly assigned to receive either an active PRFE device or a placebo. Wearing the device overnight for 1 week, they recorded their morning and evening pain levels using a 1 to 10 visual analog scale, so the VAS scale.
Okay, and what were the findings in this one?
Yeah, so the results of this one were really good. So the morning pain reduction in the group using the device experienced was a 40% reduction, and the by day 7 compared to day 1, while the placebo group showed a 7% decline. So there was a big difference between the placebo and the ones using the device. Evening pain on the VAS scores decreased by 30% in the active group and only 19% in the placebo group. Although this difference was not as significant as the morning pain.
And as I say, both of them will be linked below the episode. But we've kind of only really spoken about people who have already got plantar fasciitis and then treating themselves with PEMF. Could you actually use PEMF to prevent plantar fasciitis?
Yeah, 100%. So the thing with plantar fasciitis is it's more commonly really seen in people that are active. So a lot of people think that if they're active, they're healthy, maybe they don't necessarily need PEMF therapy or these sorts of modalities. But it's a really good preventative maintenance and preventative measure for plantar fasciitis, especially for those at higher risk due to those physical activities or previous injury. So maybe this has happened before. But by enhancing the cellular function and promoting the production of collagen, PEMF therapy helps strengthen the plantar fascia and surrounding muscles, so increasing their resilience to stress. Additionally, I would say the regular sessions improve blood circulation and flexibility, which are crucial for maintaining optimal tissue health. So having a proactive approach is better than not. It's not only going to aid in the healing existing conditions, but also prevents future occurrences by supporting overall foot health and addressing biochemical imbalances. So why not introduce PEMF therapy into someone who is just as active as someone who isn't?
No, for sure. And for these people who do have plantar fasciitis or also now trying to prevent it, how would you then apply this for that?
So obviously plantar fasciitis is specific to the foot, the heel. You can apply a localized device to this. We would normally recommend, if you're just going to use a localized, to try and go as high intensity as you can because you want it to be maximizing the area. But again, as we always say, I would always recommend a full body PEMF system and a localized applicator with that system. So basically, the benefits you're going to get from the circulatory system using a full body, and then if you can apply it on the area to kind of intensify it in that area. So that's the best way you're going to do it. There are PEMF devices that you kind of just rest your feet onto. Again, so if you can do that kind of like throughout the day or do it under your desk and just apply it to a feet or even on a full body mat, people can fold them up or just lay them on the floor and put the feet on them. But my ideal situation, as I say, as always, full body mat, laying on it and apply a localized applicator to the foot or the heel for plantar fasciitis.
Okay, so say someone does get a full body mat and they're now laying on it. Normally, obviously, if you're laying down, your feet would be facing kind of away from you as such. But say you were to put your knees up and actually then put the soles of your feet onto the mat, would that be a better way to apply it using the full body mat?
Yeah, so if you've got a full body mat and you don't have a localized applicator to apply directly to the area that's painful, that would be one way of doing it. What I would say though is you want to find out exactly where the coils are in that full body mat, because you want to maximize it by putting your feet on those coils that are specifically located within the bottom of the mat. So that would be one thing, and definitely one way you can do it. So you can still get the benefits of the full body session, and then you could bend your knees essentially and put your feet flat on the mat while still having the ability to lay down. But do a bit of digging, find out where the coils are, the PEMF coils in that mat. Make sure you have some coils at the bottom of the mat and ones that you can put your feet directly on.
Okay, great. So say now someone's got a full body mat or they've got a localized applicator. How long are they going to have to apply this? Maybe each day, each week, each year to be able to get the results, and how kind of long each session for?
Yeah, so plantar fasciitis can be quite a painful condition, and the best way to kind of maintain your results with this is to look at pain scores. And we mentioned it earlier in the VAS scoring system. So pain scores, you can kind of like work that out over a period of time. And plantar fasciitis, again, it's not a condition that kind of goes away quickly. You want to reduce the area of that plantar fascia, and over time, that's going to help. So as we saw from the study, they were getting results from 4, 8, and 12 weeks. So, we're not looking at years for this kind of thing. But I would wait at least 4 weeks to notice a significant improvement in this condition.
Okay, and are people going to have to be using this daily, weekly? How frequent should they be using it as well?
Ideally, every day if you can, and at least one session a day. If the condition at the specific time is particularly painful, or if you're running quite a lot, or your kind of activity levels have increased, then obviously if you can get a session in the morning and a session in the evening, you can really knock that on the head a lot quicker.
Okay, great. But if you've got any questions now about PEMF and plantar fasciitis, make sure to leave them below this episode, wherever you're listening from, and we'll get them answered. And while you're there, if you're on an audio platform, make sure to leave us a 5-star review. And if you're on YouTube, make sure to subscribe and like. It just helps us make better episodes every single week and get bigger and better guests on.
Thanks for listening to another episode of the PEMF podcast.